I'm an OT. We love a model. And I think the PO model is probably one of the better models that I found in my practice. When we really have to think about there's our MS patients and what it is they want to do with seating out. So the first thing that we're going to look at specifically, very important, is the person, the patient in front of you. How old are they? What is their general health they've got? Lot of patients we see have comorbidities. We've got a couple of patients that's got both Parkinson's and MS. We've got patients with MS and functional neuro disorders. We have patients that sort of, have got, as I say, quite a cancer in MS. So you have to take all that into consideration. Think about the person. What is their body weight? Would they need to have certain considerations? If they tiny little people, some of our patients is only 5'1", really, short stature. We got really tall people with lanky legs. Also, our slightly bariatric size patients. So we have to think about that and how does what they go into, how is that going to affect how they sit? Can that person maintain their sitting balance? If you can't maintain your sitting balance, when you're in a chair that's not supporting you, you're going to wilt effectively. And that's when we see people starting to lean off to the side. Once they get tired, the head will go one way, and because your head is about 3 pounds of blancmange, gravity will grab it and will pull you towards the one side. The other thing is to think about your level of physical function and independence. Can this person transfer? Are they able to relieve their pressure? Can they shift around in the chair? Transfers is really important. Can they do a sit-to-stand? Are they going to need help to do that? Are they now to the point where they need a transfer aid? What type of transfer aid might they need? Are they now being hoisted? So that's one of the things to really think about, and also their pressure relief. I myself like to do the Waterlow score. It's a good way of keeping track of a patient's risk of developing pressure. The other big important thing is people's mood, the person itself. So think of the person and how is all of this affecting them? Some people we see are newly diagnosed and coming to terms with they've now got this long-term condition that they're going to have to learn to manage and the impact this is having on their life. Some people have lived with it for a while, but it is sort of having to learn to live with the deterioration that sometimes come with relapses. Pain is very important, as important as fatigue. If your person is in pain, you're going to have to think about spending 4 or 5 hours in the chair, not moving around. What is that going to do for their pain? Lots of people, as I say, come with musculoskeletal problems. So they can either have contractures, they can have range of movement problems, they might be kyphotic, there might be scoliosis. So you have to think about when they sit, where is their body going, where's their head going? Of course, with any neuro condition comes abnormal tone and spasticity. And thinking about if someone has spasms, how will that affect how they sit in the chair? Also, if they are now not able to move their muscles as much, they will be atrophy. So what happens? How does that influence them? We talked a bit about skincare already. So think about their circulatory status. Have they got any history of skiff brain down before? Continence is very important, because if someone is unable to manage their bowel and bladder, you're going to think about the impact that the moisture is going to have on their skin. So thinking about when they sit in this chair for a long time, that how is it, does it breathe? Does it help their skin breathe? Fatigue, we talked a lot already about it, but fatigue is one of the major big things. How long can they sit in the chair for? And if they get tired, have they got the ability to relieve that? The same with the pressure, the same with the pain. The next very important thing is thinking about what is it that your person wants to do. I'm an OT. Occupation is what we do. Occupation is what we do, the things we do to give us purpose and meaning in life. And that can range from anything, being able to feed yourself, brush your teeth, comb your hair, put your lippy on, being able to just sit and chat with your family, to watch your favorite tele program. So it's very important that when we think about a seating assessment with patients, what are they going to do in that chair? What is that chair going to allow them to do that they now can't do, or that they're really, really struggling with? Think about their routine. How does your seating, what you're going to give them, fit into their routine? A lot of times we get asked, oh, can a patient come out? But they can't tolerate to sit out for more than an hour or 2 hours. And what ends up happening is that the carers only comes back in 4 hours. So think about the routine they're going in. How do we sit them out? We still have a fair bit of patients with MS that still works. Some of, and you have to also think about if they're going to work in the office or they're going to work from home. If they spend a lot of time sitting, you need to think about how is their productivity, how is that seat going to affect it. And then, of course, leisure. We are people who like to go and have fun. Things that work or can't always work. We need to have a bit of fun element in our life, something else that gives us a bit of meaning. So you need to think about that aspect. The other thing is, does it promote your patient's health? If you've got someone who is needing to feed themselves, but they can't because they're in bed and they can't get their hands up to their mouth, or they're on a peg and they need to be upright a little bit, would your chair help them to sit up, being able to do that, but also keep them healthy? And then lastly, think about the environment. So we need to think about the society and what that person lives in. What goes on around them? Who is their support network? What's the actual culture they sit in sometimes? Think about the physical aspect of patients. What room is it going to go in? Is it going to be cluttered? Is there actually space for it to go? Think about what maybe aids they need to have with them. Lots of people want a table. Some of our patients end up with eye gaze systems that needs to be on wheels, or all kinds of other aids that comes in. Environmentally, if they have someone come over to come and visit them, lots of my patients is very aware that they don't want to look like they're in a hospital. So they want also to have the aesthetics of when they sit in a chair. Other thing to think about is the temporal, relating to their time of day. When are they in that chair? What happens? Then also lastly, as I say, we talked about the communication side of things. When people get really tired, a lot of their symptoms will increase. So think about our patients who are maybe working from home and they are on Zoom calls all day, and they're having to communicate. And the tighter they get, the harder it becomes, especially if their seating isn't quite supportive enough. Then just very, very basic assessment principles that I always have in the back of my mind. The height of your seat must allow your users to sit with their feet flat on the floor and think about what they wear on their feet. Flat, it's better to say, show me what type of shoes are you going to be sitting in, whether it be trainers, slippers, boots, or whatever it is. The width of the chair is very important, that we have enough support to stop them from leaning. So how wide the chair is, but also if it's too big, they wilt. If it's too narrow, they wilt over the top as well. Seat depth, so how long is it from your bottom to the back of your knee? How that support your femur needs, to make sure that if it's too long, then it pushes up against your back of your knees, it will give you pressure problems. If it's not long enough, people find that they will start tipping forward. other very big thing to think about is people's armrests. So think about when they sit in the chair, and if you give them, especially if you give them pressure care to sit in, will they be slightly raised? So when they put their arm on the armrest, where is that elbow support going? The handset is the other thing to think about. Number one, can they operate it? Think about which side the handset gets to go, and also whether your patient can cognitively safely operate this chair. Think about the back. It should be high enough to support your upper limbs and your shoulders, and avoid pressure onto your large joints. The other big thing is the fabric, what you put them on, especially if people's got continence problems. Comfort is very important, but also you need to think about the pressure things. But very importantly is to set goals with your client or your carers, so that you know what it is that they want to achieve from sitting out, and how can you guys work together to do that.